Hello everyone, welcome back to my channel. For you who are new, I'm John, I'm CIO, founder of VSHR Group. So today we're going to talk about how you can help the digital media technology so you boost your revenue in healthcare models. So not only one or two, today I'm going to go through 1 to 10 key aspects and ideas which you can use to boost your revenue if you have been considering to generate more revenue for your healthcare. And all these 10 ideas will help you to use by using different digital media initiatives to generate more revenue. You want that, right? Even actually most of the idea not only can work for healthcare but for other industry too, but this video I'm going to be specifically for the healthcare industry. So what are you waiting for? Let's get started. Number one is a preventive care. So with the digital media, you can really build a great preventive care, which could be a new stream of customers and new product delivery from your healthcare perspective. Let's say, example, you have a particular hospital or clinic, you have a particular amount of doctors, and you've been last 5 years, you have been serving for, let's say, a few thousands or probably 100,000 patients. So you have their contact informations. But now you can, by using that information, with the right digital media strategy and execution, with a little bit of training of your existing in HR professionals and medical professionals, and you can work together to design a preventive care based on your capability. But there is, however, you need to plan what kind of capability you have in-house, but more importantly, you have that customer base. And now reaching to that and delivering right kind of product development, preventive care through your medical teams and using a right digital media strategies can make it happen. So this is the number one thing. You can build a whole preventive care model, business model, by using digital media. Number two, upskill your medical team. Like this example, you have doctors and nurses and who are working on providing the care. You can actually upskill their medical team, a team's skill by using digital media. You can generate different kind of online courses for them and to perform their and execute their skill development. How to do that one? Let me help you out with this one, which could be very cost effective. Normally, to train your team, what do? Normally, you send them different kind of conferences and events, which is quite expensive in terms of sending, because the tickets of this conference are not really cheap, and plus it's like very much like a one-off solution, and you don't really know what will be the complete package it is. But with the based on that one, based on your medical team and medical customer segment, what you need, you can put it all together, build a great course curriculum overlaid. You can bring up in a course curriculum expert with you to design the program with you, and then you can bring up the right medical teams members from your team who are really good and up to date on the knowledge, or you can bring an outside expert to come to your team, and you can build those video course with you by shooting videos like this, and then you can deploy it in an online learning program, and you can use it to over train your team for existing team and newly joining team. At the same time, you can actually do an assessment on top of it. So every 6 months, you can do a continuous assessment to see what is existing skills of your team, medical team, because this is very crucial, because their skill and their up-to-date knowledge is going to be directly proportional to and impact your customer experience, which is your passions. Number three, upskill your medical team. You can do exactly the same way. You have other HR, finance, IT, customer service, so many other peoples in your healthcare service provider, right? So what you could do exactly, you could also do an online program for developing their skill set, what exactly they need to do in sales, marketing, IT, customer experience. You can build the right curriculum, bring up your in-house great champions, and you can bring up a right digital media agency to work with you and build those curriculum. You can tell the agency to bring an expert for outside in case if you need more up-to-date expertise skill in your videos, and then you can shoot it as well, and then you can deploy it in a particular platform to run those online learning program for your particular team. And that's the way you can really help you to be successful on this one, to deploy a end-to-end digital media project, which is basically your online learning program for even non-medical teams. Number four, build your brand on digital space. So until now, whatever happened to you, you probably have a clinic or have a particular doctor. I know it's a very much localized thing. Like an example, if you're in a particular city, your customer, most of them coming from the city, almost 10% of the customer. So what you could do actually, you can actually open up a new targeted branches. You can open up another one. So to do a new branches of your hospital to another city, you need to build a brand. So you can use the digital media to build the right brand with the right strategy. At the same time, you can open up a preventive care, or you can open up a telemedicine platform, and you can do the right branding of your hospital to not just a new city, but over all the places, by all over the country or over the region, by using digital media platform, digital media content strategy and deployment too. Number 5, the telemedicine is such a great aspect. There's a lot of people who have been talking about it, but so one of the key reasons telemedicine is not becoming successful is this. Most of the telemedicine platform is coming from tech service providers. So the tech company building telemedicine platform and who has no idea how the actually care and hospital has been given. So that's why most of them are not really being successful. And the second reason they're not being successful is this one, as they did not significant amount of time in terms of building the trust, and to build the trust they did not build enough amount of content. And that's where you come to play. If you're a healthcare service provider, you can build a telemedicine platform. You have your expert team members already in your brand, and what you could do actually, you can bring up more or digital media platform agency as a partner with you and build a great amount of content around your telemedicine platform, and that will help you to buy into a customer. But here is the point: you already have your existing customer who have been doing it for last 100,000 or 5,000 people. You're reserved already as a patient. Now you can even bring in cross-functionally bring into telemedicine to them as well too, because now at the time when I'm shooting this video is the COVID time. The hospital has a lot of issues in terms of bringing customer to your hospital, but if you do it right now, it can really help you to generate brands and telemedicine brands to make your platform acceptable for your customer. But however, you got to remember, it's going to take time. You cannot just build a brand of a telemedicine platform, even you already in hospital too. You need to pay the patients, and you need to bring the right player with you to work with you as well. Number 6, you can reduce the follow-up calls. Your hospital has a lot of type of follow-ups. Some of the follow-ups are quite optional. So what you could do when you are actually selling part of a package deal, you can add on some kind of follow-up digital media content onto that one and can deliver to your customer. Like an example, if your package has total one main operations, and then you probably have 20 other follow-ups, and then you can add more or even replace some of the follow-up meetings by a digital video or even online call. So that will reduce the traveling time of your patients and also your medical team resources as well too. And that will help you to reduce your or direct proportional work into the platform, and your clients patients can see your digital media video or even on a Zoom call or any kind of digital media video calls can help them to even get into your telemedicine platform as well too. So that is one of the way you can indirectly promote your telemedicine platform, and that will get going and become more successful. Number 7, passion and hospital communication, or your promise communication. So what happens most of the time if you're in a hospital, clinic, or dentist, dental care provider, patients come, sit down, and they don't have much thing to do. They probably spend the time on phone, looking around to people. Most of the time they spend time on the smartphone. So this is the point. If you have the right screen around you, this waiting area, and you can put it on different kind of valuable content for them, really valuable content, which is not about promoting about your product, but actually giving great value to your customer. So which they will look into your screen and feel like they are learning something, they can take away something really great value. That will be putting you in a really good winning position, because that will show you're giving more values than what you promised before they come into the promise, and you then come into it and you can get really great contents, videos, ideas which can then take care of the health and their other activities even in their life. So they will take away with that value, and that will help them to build a better relationship and connection with the hospital or dental care provider and so on, and clinic. So that will help you to make your organization more successful. Number 8, webinar. So there is such a way you can organize different kind of webinar for your patients to build more connections with the hospitals and the patients as well too. So there's a lot of a webinar you can position in different way. You can bring up your existing patients, and you can share about different kind of healthy tips or preventive cares, or you can talk about a particular chronic disease tips into them, so they will feel more value. And as a webinar, you can do it in a very cost-effective manner. And patients are or those peoples who are your customers, who was your patients, so they will be much easily going to accept that one too. At the same time, you can also do a webinar to promote about your new type of products and services you are bringing on, and the promotions into that blended as well too. But however, I strongly recommend that one, rather than doing a product marketing webinar, you focus about giving really true value to your audience, and that will help you to build a really good connection. And that's why people will be interested to join your webinar if they feel that you were just marketing your own product, and that's why you're doing webinar, and that will make them reluctant to join and take part in your webinar. Number 9, you can do a podcast. You can run a podcast, and you can run the podcast to different social media platform, and you share about a particular crucial tips about a particular chronic disease, particular issues people therefore are providing, their preventive care provided, the tips for the children. Make sure that you bring up the right professional and specialist about that field. You don't need to hire any kind of famous person, but you need to bring up some really credible medical professionals to be in a podcast, and you can do a live show, and you can do a Q&A, and that will help you to connect yourself and your brand to your audience, and particularly your future customer or present customer, and they will be able to value, and they will see and learn from you. Number 10, cross-sell. Of course, when you do all these kinds of relationship you're building over time, they will be understanding when they're a customer, and they can get information of other kind of product and services you're bringing on. So they will know about your other product services. They will be interested to know about you because they already trust you, and you already build a much more better connection rather than a passive connection, what you have right now. They most of the time they come to your hospital or on your premises, they will get service, they'll get out, and they're gone. So that's the way you can really change this whole space, rather than only as a passive business model to a much more proactive business model that will help you to generate more revenue. So here's my key takeaway, that I gave you the 10 tips that will help you to generate more revenue as a healthcare service provider. So let's go ahead and execute into it. Let me know, is there any questions or how you want to execute in your promises. Comment below in your questions. I would love to give you an answer. If you have any particular challenge you are facing in terms of executing digital media for your business, go on and comment below too. We'd love to see your problem and give you an advice as well too. And here we go. Your healthcare service providers, your organization, your mission is great. You want to serve the health of other people. Let's do this one. Let's do this digital media technologies and these opportunities to bring your service to the more people, so you can be more successful and generate more revenue. All the best.